Hi, I'm Dr. Greg Grillo at Express Dentist, and I'm here to speak a little bit about dental trauma. Unfortunately, accidents happen, and it usually happens at a really unexpected time. That's what makes it an accident. And at some point in time, it's estimated that up to 60% of people are going to have some type of dental trauma. And this involves anything around the mouth, in the mouth, the teeth, the gums, the bone that holds the teeth into place. And, most of the time, this trauma is pretty minor, but sometimes it can be fairly significant. And it's good to try to gauge and understand what may have happened. And of course, to get an assessment just as soon as possible, no matter what has happened, because sometimes there's damage that is much more significant than what you realize or can assess. And it may take a dentist and dental x rays and clinical exam to figure out what is going on. And sometimes time is of the essence with these injuries. So what are dental injuries? What do we classify those as? So it could be a chipped tooth, just a little piece off. It could be a fractured tooth, something fairly large, maybe half the tooth or more. We could have tooth subluxation, which is when the tooth is actually loose, or tooth avulsion, and that's when a tooth is completely knocked out of the mouth. And then there's tooth intrusion, where the tooth gets actually jammed up into the socket. And then, of course, there's lacerations or cuts that involve all the soft tissues, including the lips, the tongue, and the gums of the mouth. So most dental injuries are caused by sports, or, of course, an accident, maybe just horsing around, or a fall is common as well, or automobile accident, those types of things. But a lot of the contact sports include mouth injuries, and people are surprised to learn that the most common sport that causes a mouth injury is basketball. And so any of these activities where there's elbows and body parts flying around can lead to a mouth injury that can become fairly serious. And of course, when children are growing and learning just to move and walk, around ages 2 or 3, there are injuries that can occur at that time as well. And that involves the baby teeth, and that's something we'll talk about just a little bit in a moment. So a chipped tooth is when a little piece of the tooth actually just comes off, and it could be real sharp or jagged. It may bother you the way it looks, but usually the repair is fairly simple. It may involve just a little bit of smoothing or maybe bonding. If there's more to it involved than that, then there may be a need for more extensive repair. So if you have a tooth that's actually fractured, fractures can be of different depths, and some of them can actually go deep enough that they expose the internal part of the tooth where the nerve is in the pulp. And if in some cases, kind of rare, but the piece of tooth is broken, may be reattached or rebonded. In more complex cases, we're going to use filling material, or you may need a root canal and a crown. But usually a fractured tooth is repairable unless it's fractured completely down below the gum line. Now, subluxation, we mentioned, that's where a tooth becomes loose and it's been displaced. And it's possible to actually splint that tooth with some bonding or maybe a wire, some fibers to the teeth next to it for a couple of weeks until it firms back up. And in most cases, those teeth are going to be okay, except in some of them, they may need root canal treatment later down the road. And so an avulsion, now this is when when a permanent tooth is completely knocked out of its socket. And that's a pretty serious dental injury if it involves a permanent tooth. And a lot of this, how this turns out, depends on how it's treated and how quickly it's treated. The sooner, the better. And this is one where you want to try to get to a dentist just as quickly as possible. Usually we want to try to replant that tooth into the socket if it's been displaced. And if that's not possible, then you may be looking at some type of replacement down the road, like an implant, for example. And so if a tooth comes out completely and you're able to put it back into place, do it and get to a dentist hopefully within minutes, actually. If that's not possible, you may put it up underneath the lip to where it stays moist with saliva. And you can also place it in a little bit of milk that can that can help as well. But the prognosis for these teeth is guarded, let's say. So it's maybe a 50-50 proposition as to whether that tooth will actually survive, but you want to get treatment as soon as possible. So where do you get treatment for dental trauma? If you have significant facial trauma, head and neck injuries, the teeth are obviously very important, but there could be other injuries that are even more important. So there are times where you need to get to an ER. And so if you're having, dizziness, concussion, other types of large facial injuries, get to an ER just as soon as possible. If the injury is confined to the mouth or to the teeth, it's not severe, it's not life-threatening, it's best to try to get to a dentist, because the dentist is the one that's going to be able to treat the teeth. They rarely do anything in an ER that's going to help with any type of trauma to the teeth themselves. And so you do want to try to get to a general dentist for chipped teeth, lost teeth, broken teeth, that type of thing. Endodontists, they are specialists that receive training to treat dental injuries and perform minor repairs. But they're there to support the dentist with more significant treatments. So it could be that a tooth has been traumatized and the general dentist gets everything stabilized for you, but then they decide that you need to see an endodontist to treat the internal nerve part of the tooth. In most cases, you do want to try to find a general dentist first, but if need be, you can only get into an endodontist. It's certainly a good option to try to get there. And of course, we're hoping that if you do need an ER, that's the treatment is limited there. They refer you to a dentist. In some cases, you may need hospital treatment, and you may need treatment with an oral surgeon to help with facial injuries, and a dentist will often be involved in that type of treatment as well. So, the best thing to do is try to prevent dental injuries. That's not always possible because nobody plans on accidents, but there are things that you can do to help cut the risk. And since we know that the vast majority of dental injuries involve sports and front teeth, there are some things that you can do. And the number one thing you can do is wear a mouth guard. A mouth guard will prevent the vast majority of these types of injuries. And again, if you are playing anything that could be deemed a contact sport, including basketball, which most people overlook for mouth guards, you really should consider a mouth guard. In fact, the International Academy of Sports Dentistry really recommends mouth guards for more than 24 sports and activities. And so that's very important. Now, if you're into other activities like rugby, ice hockey, and football, you may actually have like a face guard in place, but we also recommend, a mouthpiece very specifically for that as well. So if you have some type of trauma and you need a dentist, again, this is truly, in many cases, a dental emergency, but not always, based on some of the things we've gone through. But if you need a dentist, please reach out to us at Express Dentists. We have a trusted network across the nation of dentists and specialists that would be appropriate for helping you, and we would be glad to try to help you find a trusted resource to get in to treat a dental emergency. I'll also mention that if you are in a contact activity and you want to get a nice custom mouthpiece, it's really worthwhile to do that because they're multi-layered and they're made to fit, and a dentist can often help you get one of those as well. So if you need a dentist that would provide that type of service, please reach out and we will help you get in to take care of that as well, to avoid the dental emergency. So again, reach out, enjoy your activities, but be safe.